Hi, my name is Jane Doe, and I am a student at the University of Texas at Arlington in the Health Policy and Nursing class in the Nursing Graduate Program. And I'm here to interview County Commissioner Joe Blow. Joe Blow was kind enough to join us today, even though he has the flu. What we're here to talk about is my policy brief and my proposal. I'm very concerned that we have people who are remaining in emergency rooms without proper treatment. And what I'm talking about is patients that are in psychiatric crisis, and our community is no different than many others across the country. What we're seeing across the board is states and local governments are decreasing funding for mental health needs, and conversely, the demand is going up. We do not have any beds for these patients. When looking at the data supports that only 16% of hospitals have psychiatrists on staff. That means that 84% of patients are not being seen by the appropriate level of care. What happens is they're waiting in the emergency room to be seen. They're not getting appropriate treatment if they are not transferred out. They will self-medicate with drugs and alcohol, get in crime. If we have to commit them with order of protective custody, and sometimes we do, and sometimes it is for their good, they have that on their record forever. Telepsychiatry, if we could implement this in our emergency rooms, would allow these patients to be seen readily by a psychiatrist, real time. It decreases their wait times. It will help improve our emergency room throughput, which will help us be able to better serve the community from physical needs where they're not backed up. Saves money to the emergency rooms where it can cost them up to $2,300 for each patient that they're trying to board. Not to mention the excessive cost that it costs the judicial system for someone to enter into the order of custody and have to have a hearing and legal representation and all the follow-up that entails from there. It is been shown to be best practice. What we're doing now absolutely does not work. It's failing our patients. And so if we can get this started, a lot of patients, and states are actually now showing by evidence that this will decrease the amount of commitments needed by at least 1/3, which is significant. And if you think of all the lives that's making a difference in, it's surely something we would want to do in our community. And I was hoping that you could help me get my message out to government.
Definitely. Thank you.
Thank you. Thank you.